The behavioral health unit started about 2 years ago. We're a unit that operates for people that are experiencing crisis and mental health illness or a substance abuse issue. We respond to calls where people are in crisis that have mental health illnesses or are experiencing some sort of substance abuse. We're able to come on scene, relieve the patrol officers that are on scene, and spend more time with the people that are in crisis, and we act as the nexus to getting them into services that are local to our community. We've been on approximately 333 meaningful interactions with local people in the community. A meaningful interaction is someone that was in need of our services. So once we go out, we can make contact with them, find out the ongoing situation, and help them find the proper local resources. We operate with 2 police officers and 1 LPC clinician that is with us full-time 40 hours a week.
I ride with the behavioral health unit 40 hours a week, so that way that I can go into the community with them in order to assess clients and crisis mental health needs and substance abuse needs also. I conduct 1013s in which I conduct an evaluation on the individual in the community that is in the current crisis. We determine whether or not they are harm to self or harm to others, and if they are, we provide transport to a local facility in which they can receive treatment. From there, we also follow up with them once they are released from treatment to make sure that they attend their appointments, and if they are not able to attend their appointments due to some form of disconnect, we make sure that we find a problem-solving solution to make sure they are able to get to appointments that they need. The city of Savannah also has issues with mental health illness, just like many other large cities. We are able to help with the ones in Savannah by making sure they receive treatment and reduce the risk of them going back to jail, reducing recidivism of them actually going back into other facilities as well. We do this by doing follow-up calls and making sure they get the services that they need instead of going to jail where they would usually not receive those services.
So the Savannah Police Department patrol officers, the majority of them are crisis intervention trained. So when they respond to a person in crisis, they start the assessment on the person to figure out what kind of crisis they're in and what kind of resources they might need. And then they'll reach out to the behavioral health unit to see what kind of placement we're gonna need for that person.
The Savannah Police Department recognized that mental illness is a nationwide crisis. That's why we created the Behavioral Health Unit. With the unit, we've seen great success, and we look forward to expanding it in the very near future.